encounter astigmatism in our practices on a daily basis. We are fortunate that we have a number of options to correct astigmatism, including both glasses and contact lenses. When fitting patients with contact lenses, there are two things that we need to keep in mind. The first is to select options with effective stabilization. The second is properly identifying those that would benefit from a toric contact lens. Now, here's a soft toric lens shortly after the patient has placed the lens on their eye. As you can see, even though misaligned initially, it quickly rotates into place. Prism ballasting is the most common way to stabilize a toric lens on an eye. Additionally, the utilization of a dual thin zone design, both superiorly and inferiorly, can add additional stability to the toricity in a lens. There are a number of commercially available options in both designs, which gives us flexibility in our prescribing of these lenses. Identifying proper candidates is also critical, and making sure you provide these patients the opportunity for full visual correction will optimize their visual outcomes. When we look at demographics, we see that 48% of eyeglass wearers have astigmatism of 0.75 diopters or more. With today's technologies, these patients should always be offered a toric lens to correct their astigmatism. But there may even be other opportunities to offer patients better visual acuity. Think about the person that you refract who has a difficult time deciding between 0.5 diopters and 0.75 diopters of astigmatism. We will oftentimes err on the side of offering them no astigmatism correction in their contact lenses, but there may be an opportunity for better visual outcomes. In situations where a patient has 0.5 diopters of refractive astigmatism and is complaining of their vision in spherical contact lenses, simply hold a 0.75 diopter loose trial lens in front of the eye at the axis of the refractive astigmatism and see what the patient's response is. This may be an opportunity for improved visual quality and clinical outcomes. We're fortunate to have a number of effective toric designs for remarkable stabilization. Understand that close to 50% of glasses wearers have 3/4 of a diopter of astigmatism or more. With the toric contact lens representation in the marketplace significantly less than that, it means there is an unmet need that we are positioned to fill. And make sure to demonstrate uncorrected astigmatism with loose trial lenses, even if it's slightly less than 0.75 diopters, because there may be many that can benefit from this. Keeping these things in mind will help improve our patients' visual outcome, which is ultimately why we do what we do. We hope that this has been clinically insightful.